I'm going to talk about the experience in the UK, which I think is relevant to the experience in Italy. The two systems are not identical. And I want to make 2 points. The first is, yes, it's very important to talk about the health care system. But the second is that the healthcare system is only one input into the health of the population. I think we know with a fair degree of certainty that the health of the population, and in particular inequalities in health in the population, are not in the main due to inequalities in access to healthcare. The opening line of my book, The Health Gap, published in Italian, was why treat people and send them back to the conditions that made them sick. It means that if we want to take action to improve the health of the population and to reduce avoidable health inequalities, we need action on the social determinants of health, but we also need a properly functioning health care system. So let me talk a little bit about what's happened to the healthcare system in the UK. And you can then look at the comparability with Italy. When the Conservative-led coalition government was elected in 2010, they boasted that they were protecting the healthcare system, the National Health Service, the NHS. They were protecting the NHS from austerity. They had swinging cuts in public expenditure for the police, the criminal justice service, local government, welfare, central government, all across government, cut. But they said, we are protecting the health service. Well, in asking the question, were they really doing that? It's important not to look at the total amount of money because the population of Britain is expanding and it's getting older, and older people need more healthcare. In fact, the Nuffield Trust looked at the per-person funding of healthcare over the time from Margaret Thatcher's election as Conservative Prime Minister, followed by John Major. During 18 years of Conservative rule, the health service expenditure per person adjusted for aging went up by about 2% a year. Then New Labour came in 1997. They were there for 13 years. And they increased spending around 5.8% a year. So Mrs. Thatcher, John Major's Conservatives, 2%, New Labour, 5.8%. And then the Conservative-led coalition government decreased spending by 0.07% in the first 5 years, and in the second 5 years of Conservative government by minus 0.03%. Now, conventional wisdom is that with aging of the population, which we've taken into account, but new initiatives, new expensive treatments, innovations, healthcare expenditure needs to go up after you've taken aging into account by 1 to 2% a year above inflation. So their so-called protection meant real terms cuts, not huge cuts, but cuts. What we know is that there are 150,000 vacancies, full-time posts of doctors and nurses that have not been filled, a failure to plan for the future for the numbers of doctors we need, Of course, Brexit didn't help because recruitment of doctors and nurses from Europe stopped after Brexit. And if we look at satisfaction, patient satisfaction with the NHS, at the end of 18 years of Conservative management, about 34% of the population were satisfied with the NHS. When New Labour spent money on it and reorganised, by 2009, their last year in office before they lost the election, satisfaction went from 34% to 70%. And the number of people waiting for NHS treatment was at an historic low. If we take as a benchmark January 2009, the last full year of the Labour government, at the end of the Conservative government, the number of people waiting for treatment was 2.4 times the 1979 figure. So back in Thatcher Major time, the number of people waiting for treatment was 2.4 times, but came down during Labour's tenure. And then 2010, it started to rise and rose and rose and rose. Now, if you listen to our politicians, they blame the problems in the health service on the pandemic, on the war in Ukraine, on the cost of living crisis. If we look at the numbers, it's not very helpful to listen to what the politicians say if you're trying to understand what's going on. If we look at the numbers, from a low of the number of people waiting for treatment in January 2009, by 2019, before the pandemic, before the war in Ukraine, before the cost of living crisis, the number of people waiting for treatment had doubled. And by 2021, it had tripled. So yes, the pandemic did have a big impact, but it was part of a rising trend that had gone on. What's going on here? I said I was being interviewed. I don't normally talk about our healthcare system because my priority is social determinants of health. But I was being interviewed on radio by experienced journalists who suddenly asked me about the healthcare system. And I said, if you had the hypothesis that the government was seeking to destroy the National Health Service, then all the evidence is consistent with that hypothesis. The failure of funding to increase, the vacancies, the increase in the number of people waiting for treatment, the lack of availability of general practitioners, waiting times in accident and emergency. And I think it's part of a hollowing out of the public sector. It's a loss of faith in the public sector. If you read Gerstl's, American historian Gerstle, The Rise and Fall of the Neoliberal Order, he's talking mainly about the United States, but he said from Franklin Delano Roosevelt, 1933 election, to the election of Ronald Reagan in 1980, it was essentially the New Deal political order. Reagan ushered in the neoliberal order. Gary Gerstle says we're now witnessing the fall of the neoliberal order. But part of that is a hollowing out of the public sector. Leave everything to the market. There should be private provision, not public provision. Now, all the evidence suggests that a market is not the way to get optimal allocation of healthcare. Why would market providers want to take on complicated cases? They're very expensive. So let's leave those behind. The market is not the best way to get optimal allocation of healthcare. Yes, there could be private providers, but private providers are in there for profit. What we want to do, I would argue, is to create the conditions to bring out the best in people. People working in the National Health Service, in general, are motivated by doing the best. They're not motivated by profit. They're motivated by improving the health of the people they serve. And those of us in public health are motivated by improving the health of the populations that we serve. Now, alongside the problems in the healthcare system, in Britain, funding for organized public health has been slashed, cut dramatically. And funding for the key social determinants of health have also been under attack. So we've seen a rise in child poverty, a rise in poverty in people needing welfare, cuts to local government. And all of these will contribute to worsening health and increased inequalities in health in the population. It's time to rediscover public purpose. Remember John Kenneth Galbraith's phrase, private affluence amid public squalor? It's time to reverse that. We want a vibrant private sector, of course, but we need a healthy, vibrant public sector. And the healthcare system and the public health system are important parts of that. It's time to rediscover the public good and the importance of a healthy, vibrant public sector that's able, firstly, to take the strategic decisions that we need as complex societies, and secondly, to deliver the services that we need. Healthcare and public health should be in the forefront of this rediscovery.